In the intricate realm of pharmaceutical interventions, domperidone emerges as a multifaceted agent, orchestrating the dance of stomach and bowel movements to alleviate distressing symptoms in gastrointestinal disorders and Parkinson's disease. Yet, as this essay unravels the pharmacological intricacies and regulatory nuances surrounding domperidone, we delve into a narrative where the balance between its therapeutic prowess and cardiac considerations shapes a compelling story of medical caution and care. Domperidone, a comprehensive exploration of its use in gastrointestinal disorders and Parkinson's disease. Introduction. Domperidone, a medication known for its ability to enhance stomach and bowel movements, plays a crucial role in the treatment of various gastrointestinal disorders and associated symptoms. While its primary function is to alleviate nausea and vomiting, particularly induced by medications used in Parkinson's disease, the administration of domperidone is tightly regulated, underscoring the importance of medical supervision. This essay delves into the pharmacological properties, therapeutic uses, and regulatory considerations surrounding domperidone. Pharmacological mechanism. Domperidone exerts its effects by blocking dopamine receptors in the gastrointestinal tract. As a dopamine antagonist, it inhibits the inhibitory effects of dopamine on gastrointestinal motility, leading to increased contractions of the stomach and bowel. By doing so, domperidone facilitates the movement of food through the digestive system, addressing issues such as delayed gastric emptying and promoting overall gastrointestinal function. Therapeutic uses. 1. Nausea and vomiting. Domperidone is widely employed in the management of nausea and vomiting, particularly in cases where these symptoms arise from various gastrointestinal disorders. Its ability to enhance gastric motility and emptying contributes to the alleviation of these distressing symptoms, improving the quality of life for individuals affected by conditions such as gastroesophageal reflux disease, GERD, and functional dyspepsia. 2. Parkinson's disease. A distinctive application of domperidone lies in its role as a supportive medication for individuals with Parkinson's disease. Patients undergoing treatment for Parkinson's disease often experience nausea and vomiting as side effects of their medications, particularly levodopa. Domperidone proves valuable in managing these adverse effects, allowing Parkinson's patients to adhere to their prescribed treatment plans without compromising their gastrointestinal well-being. Regulatory considerations. Despite its therapeutic benefits, domperidone is subject to stringent regulatory measures due to concerns related to its cardiac safety profile. In some regions, regulatory agencies have restricted its use and availability, emphasizing the need for careful consideration of the potential risks and benefits before prescribing or using this medication. 1. Cardiac safety concerns. Domperidone has been associated with an increased risk of cardiac arrhythmias, including QT interval prolongation. This has prompted regulatory authorities in certain jurisdictions to restrict its use, especially for patients with pre-existing cardiac conditions or those taking medications that may interact adversely with domperidone. These regulatory measures underscore the importance of thorough patient evaluation and risk assessment. 2. Prescription only. Domperidone is typically available only through prescription, emphasizing the need for medical supervision. Healthcare professionals must assess the individual patient's medical history, including cardiac health, before prescribing domperidone. This ensures that the benefits of the medication outweigh the potential risks, and patients receive appropriate monitoring during the course of treatment. Conclusion. In conclusion, domperidone stands as a valuable medication in the management of gastrointestinal disorders and the mitigation of nausea and vomiting associated with Parkinson's disease treatment. Its pharmacological mechanism, targeting dopamine receptors in the gastrointestinal tract, underscores its efficacy in promoting digestive function. However, the regulatory considerations surrounding domperidone, particularly its cardiac safety profile, highlight the need for cautious use and medical supervision. Healthcare professionals play a pivotal role in assessing the suitability of domperidone for individual patients, balancing its therapeutic benefits against potential risks to ensure optimal patient care. As research continues to uncover more about the medication's safety and efficacy, the evolving landscape of domperidone's use will undoubtedly shape its place in the broader spectrum of gastrointestinal and Parkinson's disease management. Summary. Domperidone is a medication recognized for its capacity to enhance stomach and bowel movements, making it valuable in treating nausea and vomiting associated with gastrointestinal disorders and Parkinson's disease. Acting as a dopamine antagonist, it promotes gastrointestinal motility, offering relief to patients with conditions like GERD and dyspepsia. Particularly noteworthy is its application to managing medication-induced nausea in Parkinson's disease. However, the medication is subject to strict regulations due to concerns about its cardiac safety, with a potential risk of arrhythmias. Consequently, domperidone is often available only through prescription, necessitating careful patient evaluation, especially in those with pre-existing cardiac conditions. The essay emphasizes the importance of balancing the therapeutic benefits of domperidone with its potential risks, with healthcare professionals playing a crucial role in ensuring safe and effective use. The evolving understanding of domperidone's safety and efficacy will continue to shape its role in gastrointestinal and Parkinson's disease management. Here are some keywords and their meanings based on this content. 1. Domperidone, meaning, a medication that enhances stomach and bowel movements by blocking dopamine receptors in the gastrointestinal tract. 2. Gastrointestinal disorders, meaning, conditions affecting the digestive system, such as GERD and dyspepsia, where domperidone is used to alleviate symptoms. 3. Pharmacological mechanism, meaning, the way in which domperidone functions at a molecular level, involving the blocking of dopamine receptors to enhance gastrointestinal motility. 4. Nausea and vomiting, meaning, distressing symptoms are often associated with gastrointestinal disorders and are a common side effect of Parkinson's disease medications. 5. Parkinson's disease, meaning, a neurodegenerative disorder where domperidone is used to manage medication-induced nausea and vomiting. 6. Dopamine antagonist, meaning, a substance that inhibits the action of dopamine, in the case of domperidone, promoting stomach and bowel contractions. 7. Gastric motility, meaning, the movement of food through the digestive system, enhanced by domperidone to address issues like delayed gastric emptying. 8. Regulatory considerations, meaning, the rules and restrictions imposed by regulatory authorities due to concerns, particularly related to domperidone's cardiac safety. 9. Cardiac safety profile, meaning, an assessment of the impact of domperidone on the heart, particularly in relation to the risk of cardiac arrhythmias. 10. QT interval prolongation, meaning, a cardiac condition associated with domperidone, where the time between heartbeats is extended, potentially leading to arrhythmias. 11. Prescription only, meaning, domperidone is available only with a doctor's prescription to ensure proper medical supervision. 12. Risk assessment, meaning, the evaluation of potential risks, particularly those related to cardiac health, before prescribing domperidone. 13. Patient monitoring, meaning, the ongoing observation of patients during domperidone treatment to ensure safety and efficacy. 14. Therapeutic benefits, meaning, positive effects of domperidone in relieving symptoms and improving the quality of life for patients with gastrointestinal disorders and Parkinson's disease. 15. Adverse effects, meaning, undesirable and potentially harmful outcomes associated with domperidone use, especially in the context of its cardiac safety. 16. Healthcare professionals, meaning, trained medical practitioners are responsible for prescribing, monitoring, and assessing the suitability of domperidone for individual patients. 17. Arrhythmias, meaning, irregular heartbeats, a concern associated with domperidone that necessitates careful consideration before use. 18. Quality of life, meaning, the overall well-being and comfort experienced by individuals are improved by the therapeutic effects of domperidone. 19. Balancing risks and benefits, meaning, the delicate process of evaluating potential drawbacks against therapeutic advantages, particularly in the context of domperidone. 20. Evolution of understanding, meaning, the ongoing process of gaining insights into the safety and efficacy of domperidone as research and medical knowledge continue to advance. Here are some questions and suggested answers based on this content. 1. What is the primary function of domperidone? Suggested answer. Domperidone enhances stomach and bowel movements by blocking dopamine receptors in the gastrointestinal tract. 2. In what conditions is domperidone commonly used? Suggested answer. Domperidone is used in gastrointestinal disorders and for managing nausea and vomiting associated with Parkinson's disease medications. 3. How does domperidone exert its pharmacological effects? Suggested answer. Domperidone acts as a dopamine antagonist, inhibiting the inhibitory effects of dopamine on gastrointestinal motility. 4. What symptoms does domperidone help alleviate in gastrointestinal disorders? Suggested answer. Domperidone helps alleviate symptoms such as nausea and vomiting in conditions like GERD and dyspepsia. 5. What is the distinctive application of domperidone in Parkinson's disease? Suggested answer. Domperidone is used to manage nausea and vomiting induced by medications prescribed for Parkinson's disease. 6. Why is domperidone subject to strict regulatory measures? Suggested answer. Domperidone is associated with cardiac safety concerns, including an increased risk of arrhythmias, prompting regulatory restrictions. 7. What is the cardiac safety profile of domperidone? Suggested answer. Domperidone has been linked to QT interval prolongation, a cardiac condition that may increase the risk of arrhythmias. 8. Why is domperidone typically available only through prescription? Suggested answer. Prescription-only availability ensures that domperidone is administered under the immediate supervision of a doctor, considering its potential risks. 9. What is the significance of risk assessment in domperidone usage? Suggested answer. Risk assessment evaluates potential risks, especially those related to cardiac health, before prescribing domperidone to ensure patient safety. 10. How do healthcare professionals contribute to safe domperidone usage? Suggested answer. Healthcare professionals assess patient suitability, monitor individuals during treatment, and evaluate the overall risk-benefit profile. 11. What role does domperidone play in gastric motility? Suggested answer. Domperidone enhances gastric motility, promoting the movement of food through the digestive system and addressing issues like delayed gastric emptying. 12. What are the adverse effects associated with domperidone use? Suggested answer. Adverse effects may include potential cardiac risks, necessitating careful consideration and medical supervision. 13. Why is patient monitoring crucial during domperidone treatment? Suggested answer. Patient monitoring ensures ongoing observation to detect and address any potential side effects, maintaining the safety and efficacy of the medication. 14. What are the therapeutic benefits of domperidone? Suggested answer. Therapeutic benefits include the relief of symptoms and improved quality of life for individuals with gastrointestinal disorders and Parkinson's disease. 15. How does domperidone contribute to the balance of risks and benefits? Suggested answer. The medication's efficacy is weighed against potential risks, emphasizing the importance of individualized risk assessment before prescribing. 16. What are some considerations related to the evolution of understanding domperidone's safety and efficacy? Suggested answer. Ongoing research and medical knowledge contribute to an evolving understanding, shaping the medication's role in the management of various conditions. 17. What is the main concern regarding domperidone's cardiac safety profile? Suggested answer. The main concern is the potential risk of arrhythmias, particularly those associated with QT interval prolongation. 18. How does domperidone improve the quality of life for patients? Suggested answer. Domperidone's therapeutic effects alleviate symptoms such as nausea and vomiting, contributing to an overall improvement in the quality of life for patients. 19. Why is balancing risks and benefits particularly emphasized in domperidone usage? Suggested answer. Balancing risks and benefits is crucial due to the medication's potential cardiac risks, necessitating careful consideration of its appropriateness for each patient. 20. What is the overarching theme regarding domperidone's role in medical care? Suggested answer. The overarching theme is one of medical caution and care, where healthcare professionals play a pivotal role in ensuring the safe and effective use of domperidone. This content is mainly for the purpose of learning English vocabulary, English grammar, and English sentence structure. We are learning American English. Thank you for taking the time to watch. Thank you for considering subscribing to see more exciting videos.